Well, good day, everybody. My name is Dr. Howard HCAHPS. I am the Medical Director for Healthcare Excel, and today we're going to be discussing improving hospital consumer assessment of healthcare providers and system scores, or HCAHPS scores. And we're going to take a little bit of a unique spin today to the typical methods of hopefully improving HCAHPS scores for providers. We're going to talk about something called the service profit chain, as well as something called emotional intelligence. And by tying these two together, hopefully we'll give people some tools to increase their HCAHPS scores and, as we'll see, increase some profitability within the hospital system. We're going to give you a brief overview, and most of the topics I want to discuss very briefly are what we know. And we know that the healthcare industry employs the greatest number of people in the United States, and it accounts for 16.2% of GDP and costs over $2 trillion a year. And there's pretty fierce competition between hospitals, ambulatory surgery centers, outpatient clinics, for patients, because patients are customers and patients are what drive their business. And with the patients having the ability to, I wouldn't say shop, but go to different facilities, different clinics in the area, there are ways that facilities, providers are being graded. And these grades are being found on websites such as Hospital Compare, U.S. News and World Report, as well as Health Grades. And we're going to discuss today that high quality in the workplace is going to be associated with high customer satisfaction or patient satisfaction, which will hopefully increase, which will lead to HCAHPS scores being hopefully higher once we understand the methods that will improve patient satisfaction. So patients do have expectations when they come to the hospital, and with this, the hospitals are becoming more patient-centered. Excellent customer service is needed from everybody who's involved in the healthcare system, whether it's the person that works in the cafeteria, the doctors, the nurses, the maintenance workers, people who are involved with transport. If customer service is high, we think that the patients become more satisfied, and thus the HCAHPS scores will improve. And in general, patients know, as I stated earlier, that they've got options and they can go from different facility to different facility if they feel like that they're not, if the facilities are not meeting their expectations. So all of this ties into value-based purchasing, and we're not going to go into value-based purchasing in great detail today, but starting this year, CMS is withholding 1% of base operating DRGs, and this money is going to come back based upon how well hospitals perform on certain metrics in certain domains. And 30% of the score is related to the HCAHPS scores. So if the HCAHPS scores are high, as well as the remaining scores are high, the hospitals will have the ability to recoup this 1% and possibly even generate more revenue for their hospital. So the Hospital Consumer Assessment of Healthcare Providers and Systems is a national standardized patient survey. Patients get these surveys when they leave the hospital, and they're able to grade the hospital as to how well they thought they received certain aspects of care while they're in the hospital. And it's a voice for the patient more than anything else, and it allows hospitals to be compared against one another. And there are eight dimensions for HCAHPS, and from top to bottom, it talks a lot about communication, so communications with nurses and doctors, communications patients have about their medications, pain management, how responsive the staff was to the patient, how clean or quiet the hospital room or the hospital was in general for the patient. Any discharge information and how well it's relayed to the patient is important, and the overall rating of the hospital goes into these HCAHPS scores. And we're going to show you via the service profit chain how excellent customer service is related to both customers as well as employees. And here's a little cartoon that states someone calling themselves a customer says they want something called service, which is quite interesting. But service, to be defined, is simultaneous production and consumption. So service for a patient is defined by the patient being in the production area. So a patient in the hospital, they're receiving service. Services are social in nature. They cannot be resold, and they can't be stored. So a patient is in the service production area at all times. And in general, successful service companies or successful service hospitals do a number of things well. They pay attention to factors that drive profitability. They take interest in both the customers as well as their employees. Technology is available for the workers or employees. Training processes are put into place that work well. And often at times, compensation is linked to performance for employees. And all this helps drive successful service companies to do better. And now we're going to show you how important it is to link the customer or the patient and the employee. And they're equally important. With high employee satisfaction, you'll have a loyal customer, and hopefully the company's profits will rise. So just as an aside, a couple interesting stats. The lifetime value for a pizza eater at a pizza parlor can be up to $8,000 for that restaurant. Those who own a Cadillac dealership, the lifetime value can be up to $332,000, and when you're talking about the airline industry, it could be billions and billions of dollars. So retaining an employee is very, very important. Retaining a customer is very important. So over the next set of slides, we're going to show you about the service profit chain and emotional intelligence. And we're going to show you how they're both linked and how they can help increase HCAHPS scores in a hospital. And the service profit chain is the link between profitability and the employee. And the emotional intelligence, real briefly, discusses, tells you about how well a person is in touch with their emotions within the environment. So the keys to success, again, are employees as well as the customers. And the customers and employees are intertwined with the company, and this graphic shows that as well. So here are the links in the service profit chain. We're going to go into all these links in detail, and I'm going to show you a graphic in a few minutes. But as it can be seen from top to bottom, revenue, growth, and profitability is directly linked to internal service quality, which is how well the employee is served at work, and I'll show you what that means in a couple of seconds. And here's a schematic, which again shows you that revenue growth and profitability, again, which is hopefully our HCAHPS scores going up, is related to internal service quality, which is workplace design, job design, how well employees are selected and developed, and what kind of rewards employees get while they are at work. So we're going to start from the right side of the screen and work our way backwards to show you how all this interacts. So the last part, or in this case the first part, profitability and growth, comes from a loyal customer. And we know that a loyal customer is just as important as the quantity of customers. And this ties in with value-based purchasing, where quality of care is probably more important than the quantity of care. And depending on what kind of study you read, a 5% increase in customer loyalty can increase profits anywhere between 25 and 85%. So having a loyal customer looks like it's just as good as having a high quantity of customers. So what makes a customer loyal? Well, a loyal customer is always satisfied. And the most satisfied customer you can have is a customer called, or a patient called, an apostle. And these customers or patients tell others about how wonderful your service is and bring others to your company or bring others to the hospital. And the opposite are the terrorists. The terrorists speak so poorly about your company or your hospital that they deter others from coming. So the goal, from a service standpoint, is to create apostles and hopefully avoid the terrorists. And here the HCAHPS scores are directly involved, because the more apostles you have, the higher HCAHPS scores are going to be, the more profitable you're going to be. You'll be able to retain that 1% and hopefully drive it up even higher. So here's a diagram of the apostles and the terrorists. And as we can see, those that have that are very satisfied create a positive environment, and those that are not satisfied or extremely dissatisfied can deter others from coming to the hospital or using your facilities. So what drives customer satisfaction? Well, it's value. And the definition of value are the results received less the costs. And these costs are not necessarily price, but from a patient standpoint, it could be the cost of waiting in a waiting room, waiting for a diagnostic test to be done. If there's a problem with a test or a problem with a provider, what it costs to fix these problems from a patient perspective. And when we talk about the service profit chain, we talk about external service value. And these are the results of employees that customers see. So it's important that the employees present value towards the patient or towards the customer, and it's can be seen here that the more value that the customer or the patient perceives, the higher the HCAHPS scores are going to be. So now we're going to start shifting our focus more towards the employee or the hospital worker. And we know that a productive employee will create value for the patient. And productive employees will definitely lower the cost of operations and ensure that customers are satisfied. And when you have productive employees, usually you'll see very, very low employee turnover, because a really great cost of employee turnover is lost productivity and then decreased customer satisfaction associated with new employees trying to learn a new service. And when you have a loyal employee, you're going to have a satisfied employee as well. And as we just stated, low employee turnover has been linked highly to customer satisfaction. And when an employee is satisfied, the employees are retained, they're loyal, and they're able to drive, hopefully, profitability and growth and increase those HCAHPS scores that we've been mentioning. So the question is, what drives employee satisfaction? Well, we want all of our employees to be happy. Okay? Very, very important, because the happier they are, the more loyal they are, the more satisfied they are, the more the customer, the more the patient sees this. So in the end, we talked about this earlier, internal service quality hopefully will drive employee satisfaction. And internal service quality is measured by the feelings that employees have towards their job, towards their colleagues, and towards the company. And we know that high internal service quality is associated with the ability and the authority of workers to achieve results for their patients or for their customers. So the more an employee can feel like they're doing a good service or treating their patients well, and then have the ability to treat their patients well, the more value will be shown to the customer, again, which will hopefully increase the HCAHPS scores when they come out. So internal service quality is characterized by the attitudes people have towards one another within the workplace, the way people serve each other, and this ties in directly with what we're going to talk about shortly, emotional intelligence. And then satisfied employees usually will have surrounding them productive coworkers. They'll have a well-designed work environment, and they'll usually have technology which will help them perform their job to the best of their ability. And this is the service profit chain. It illustrates the role of how employees are linked to their customers, and with highly satisfied employees producing value for the customers, hopefully will give a patient or customer the ability to feel satisfied with what service that they've been rendered, and hopefully will make these patients give the providers high scores on the HCAHPS scores. Customer satisfaction, customer loyalty are key, and they're definitely related to how well the employee performs for the customers. So when you look at all this from a leadership perspective, chief medical officers, chief nursing officers, CEOs and COOs, everyone needs to get involved with the service profit chain. With this, they'll be able to listen to their employees as well as their customers, and a positive environment and a positive culture can be created when everything is taken into consideration. And here's a quote that I found that was quite interesting. Leadership is practiced not so much in words as in attitude and in actions. And it's a pretty powerful quote. And we can do a leadership audit, and we can to see extent how well the company's leadership is doing for their, how well they're doing for their employees as well as they're doing for their patients. Is the leadership energetic? Are they creative? Are they participatory? Are they caring? Do they listen and coach versus just supervising? Hopefully the leadership is motivated by mission. They lead by demonstrating their own values, and they spend time developing their employees. And with all of this, the employee hopefully will become more satisfied, more loyal, less turnover, and create value for the patients, which again will hopefully increase the HCAHPS scores. And next we're going to kind of transition into the emotional intelligence aspect of the talk right now. And the next two slides are quite busy, and we don't need to look at them in detail, but we're going to get to everything that they have to show you in a few slides. And here's a little schematic of emotional intelligence. And I'm going to give you some exact definitions momentarily. So emotional intelligence can be defined many ways. Quickly, it's the ability to use emotions adaptively. And then as we go down and get a little bit more in detail, emotional intelligence is the ability to effectively use emotional information in reasoning and behavior, and the ability to perceive and express emotions positively, to use emotions to facilitate thinking, to understand and reason with emotions, and effectively manage emotions within oneself and within relationships. And we're going to break it down in a couple slides even further. But there's some key parts to emotional intelligence. It's personal competence as well as understanding the environment. So if people are aware of themselves and can self-manage themselves positively and incorporate this with their social situations, having social awareness and managing the relationships positively, emotional intelligence should increase. And emotional intelligence can be thought of similar to an IQ. And the higher your EI or emotional intelligence, the better off the employee or yourself will be in any situation, whether it's in the hospital situation or at home or in the community. So those with high emotional intelligence have certain abilities. They're able to perceive their own and others' emotions and can express their own emotions in a positive or beneficial manner. They're able to facilitate thought and problem solving through the use of their emotions. They understand their emotions and the relationships that are involved with their emotions between others. They can manage their own emotions in a positive and beneficial manner, and they can use their emotions positively when it comes to life's tasks. So from an organizational standpoint, emotional intelligence is tied directly into employee job satisfaction. The leadership is important. Productivity, the higher the emotional intelligence, it's been shown that the more productive is the employee. And all of this relates to customer satisfaction, because an employee with high EI or emotional intelligence hopefully will drive value to the customer and improve the HCAHPS scores. When a patient is in a service encounter, emotional intelligence becomes very important. Service providers, will display their emotional intelligence, and if their emotional intelligence is intact and high, customers or patients will perceive this, and hopefully, again, value will be created, increasing HCAHPS scores. We'll talk a little about a couple facts from emotional intelligence and customer service, and studies have shown that high emotional intelligence in service providers contributes to customer satisfaction. And we've talked about this over and over now. Now, the satisfied customer will drive profits and drive the HCAHPS scores hopefully higher. And customer satisfaction relates to a customer's emotional experience during a service encounter. So again, those service providers with high EI will create a positive environment for the patients or for the customers. So qualities can be seen in individuals that have high emotional intelligence. Those employees or those people that show civility, show concern, are attentive to others, are congenial, show warmth, tend to have a higher EI than others. And then there have been some studies that in the medical literature that have shown how EI is beneficial. And when a nurse says a doctor has high emotional intelligence, it's been shown to be positively correlated with patient satisfaction. They did a study among dental students, and those that have high emotional intelligence usually will have a better way of dealing with emotional stress. There's some debate in the literature of whether emotional intelligence is a personality trait or it's an ability, but it's been found to be developmental, and we know that it increases as we age and we all gain experience in life. So from a personal standpoint, emotional intelligence has many uses. The higher emotional intelligence, you'll be able to motivate yourself better in the face of frustration. Hopefully impulses can be controlled, gratification can be delayed. People will be able to regulate their moods better and keeping distress from swamping the ability to think. And those with high emotional intelligence will be more empathetic, and be able to relate better with their patients, which will drive value towards the organization. And nobody wants to feel like this. And this gentleman looks like his emotional intelligence probably is not intact. So we're going to tie everything together in the next slide or two. We know that hospitals are graded and compensated based on customer satisfaction. So there are links between HCAHPS scores and value-based purchasing, as the HCAHPS scores constitute 30% of the total performance score as well, and then this relates directly to how much money that the hospitals can recoup or even gain in addition of that 1% that was taken away. There's a direct link between customer satisfaction and employee satisfaction, and this was seen through the service profit chain. And emotional intelligence has been positively correlated with customer satisfaction. And with this customer satisfaction being high, hopefully the HCAHPS scores will be higher as well. Recommendations. The traditional methods to improve satisfaction scores, such as traditional AIDET, which stands for acknowledge, introduce, duration, explanation, thank you. This shouldn't be abandoned. This needs to be incorporated into methods that we all use to increase satisfaction scores, whether it's in the hospital or in the workplace. But the service profit chain and emotional intelligence can tie in directly with this. In general, providers should focus on employee satisfaction, which can lead directly to customer satisfaction. And as leaders and as the leadership can see, understanding emotional intelligence in their own employees as well as themselves can definitely lead to higher patient satisfaction scores. And there are educational tools out there that can be used and incorporated into what we discussed today to hopefully improve HCAHPS scores. And one last slide, we're going to quickly talk about the Medicare Beneficiary Quality Improvement Project, or MBQIP. And through MBQIP, Flex Grant programs will be able to support critical access hospitals to implement quality programs to improve patient outcomes. And phase 2 directly includes HCAHPS scores. And when we increase the HCAHPS scores, hopefully the critical access hospitals will be better prepared and well equipped to meet future quality requirements. Of course, we all know that eventually critical access hospitals may be compared to their urban counterparts. And by having the HCAHPS scores and the quality measures improved, they'll be well versed and ready if these changes ever do occur. And ultimately, the program for the MBQIP program is meant to improve healthcare services for the patients that come to the critical access hospitals. So this is quite important. And that is it. And thank you all for taking time to listen to me today.